If you need a lot of dental work and you want it done in the shortest and the most comfortable way possible, sedation dentistry is the answer. This is Dr. Atcha in Dyer, and my sedation techniques help my patients correct years of painful and embarrassing problems with their teeth in as little as one appointment, while they are completely comfortable and relaxed. Listen, I can help you too. You wouldn't think of having surgery without sedation, so why would your serious dental problems be any different?
The following videos are patients who have decided to share their story with other patients that are going to be coming into our office. They were all treated under IV sedation, and they were all very scared to come in and make that first step in that phone call to get their work done. And now they are all back on the road to medical and dental health. We have actually turned them into dental missionaries. Most of them do not need to be sedated when they come into the office for their care any longer. I encourage you to take the time to watch the video, and we look forward to seeing you here in the office. What was your experience like that made you call the office?
I was having a lot of pain in the area up here in my mouth where I had a bridge that was put in, and it was hurting terrible. I didn't know what was going on. I didn't know if I had something stuck in there or, you know what, I didn't know. So I thought, I've got to find somebody who will be able to do this, but yet my fear is the problem. I was afraid of what they were going to do, how it was going to feel. And so I saw Dr. Atcha in the paper, and I decided to give a call. And when I did, the girls who answered the phone and talked to me made me feel very comfortable about coming in here. And I made the appointment and I came. And I'm just glad I did, because I sure feel better now. I came in and met Dr. Atcha and the girls, and it was a wonderful experience. Everybody is very friendly and put me at ease and explained to me about the sedation. And of course, that's one thing I definitely did want to have when I came here, and don't remember a thing from when I went under. I remember absolutely nothing except getting up and then telling me that it was already 1 o'clock and I had been in the chair since 8, and I would have never believed that. I thought for sure I had been in that chair only 1 hour. Instead, I was in there 5 hours and never knew it. And I couldn't be happier. Everything is fine. I feel wonderful. And I would recommend you to come here for anybody.
And the next day you had no problems?
I had no problems at all. Absolutely none. The only thing that bothered me was the what do you call it, the gauze that was stuck in my mouth that day. The stitches and that. And other than that, absolutely nothing. It was just because it was something different in your mouth that you're not used to, you know. But other than that, I had no problems at all. Absolutely none. I didn't even need to take strong medicine or anything for afterwards. Just did the salt water like I was told, and some Tylenol or an Advil if you needed to. But absolutely nothing else other than that. So, you know, everything was fine, no problems. And having that out of my mouth was amazing, to get that pain gone. And like I said, I would recommend anybody to come here. They were wonderful, very, very good, make me feel at ease, and no problems.
Okay, thank you, Caroline.
You're welcome.
This is Dawn, and she's going to tell us what she had done here in our office.
Well, to start, I was a little fearful coming into the office. I haven't been to a dentist in probably 45 years, so this was a major step. Came in and had 3 hours, actually, of them checking my teeth, advising me what they were going to do, what they could possibly do to correct my smile. Made the decision to go through with it, and I'm not sorry. I've been coming back for a month now. The sessions seem to be a little longer than I would normally sit in a dentist chair. They've made me as comfortable as possible, less the coffee and the croissants they promised. But it's been very, very wonderful. I finally have a smile I'm proud of and not afraid to cover. I still have a little bit ways to go, probably another 15 hours in the chair, I suppose. But the staff has helped, doctors helped. I can't say much more than if you don't do it, you'll regret it the rest of your life.
Do you remember very much from your sedation?
Nothing. Well, little tiny pieces here and there, but not much. No pain at all. Absolutely no pain. Just groggy when you get home. And it's a great way to spend the rest of the day with a book in bed, so it was well worth that.
Okay. And what kind of experiences have you had with Dr. Atcha?
Really good. He's gentle as can be. Hasn't never once entertained the idea of pushing any further without asking. Always asking me, are you okay? Oh, you're okay. And if not, there's a remedy for it. So he's really been very gentle, very kind.
And how has it been with the office staff and the team here?
Oh, well, now that's a big thing. The office staff is great. They really are. Like I said, I happened to be speaking to one of them and tell them your receptionist makes the deal, makes it or breaks it. If it's a bad receptionist, you don't really want to come back and be greeted with that every day. So their staff and the receptionist, Dawn, has been wonderful.
Okay.
Even Jen has been wonderful.
Is there anything you'd like to share with anybody?
Just that if you don't take care of your health and your teeth, you'll be very sad. You'll be eating the baby food and the soft foods on your deathbed. And that's a sad way to look at life. But you can't enjoy even an apple going out. So go for it. It's worth it.
Have you had a change in the foods that you eat?
Not yet. No, I've been kind of babying my new teeth. So that'll come. I just haven't branched out yet.
Okay. Thank you, Dawn.
You're welcome.